Seniors, I want to inform you something that could surprise you. A number of the nutrients you're taking every morning may be quietly hurting your coronary heart, now no longer supporting, now no longer defensive. Hurting, I recognize that. Sounds difficult to trust. After all, you have probably been advised for years that nutrients like calcium and iron are important as you age and prefer many others. You have in all likelihood introduced them to your day by day, recurring with top intentions. However, here's the reality that maximum people, particularly seniors, are not advised. Number of the maximum not on you. Dietary supplements can increase your danger of coronary heart failure, stroke, or riskier, particularly when taken with inside the incorrect shape or without proper stability. As a coronary heart physician who's handled masses of older adults, I visited this first-hand sufferers who walk into my medical institution feeling first class and go away taken aback via way of means of what we discover. So please stay with me due to the fact in present-day video, I'm going to stroll you via 5 specific nutrients that would be destructive your coronary heart silently, and what you may do rather to defend it. If this topic speaks to you, go away or remark with the primary. I recognize you are listening, and remember to join Health 365 for weekly pointers designed to assist you stay robust, secure, and heart healthy. After 60, now let's begin with the primary and maximum misunderstood diet of them all. Let's start with diet E. That sounds a door. It ought to defend your coronary heart. However, can honestly place it at serious danger if taken the incorrect manner. For decades, E has been praised as a powerful antioxidant. You've possibly heard it facilitates with memory getting old, coronary heart fitness and extra, and chances are, it is sitting for your medicine cupboard proper now, perhaps in a bottle that says coronary heart wholesome, or immune assist. In truth, many seniors take 400 to 800 IU of diet every day without a second notion. However, here's what few people understand. Excessive doses of diet E can thin your blood an excessive amount of, specifically in case you're already on medicinal drugs, like aspirin, statins, or blood stress drugs. Now a little blood thinning would possibly sound like a precise issue, specifically for preventing clots. However, for a person of their 60s, 70s, or past whose blood vessels are already extra sensitive, an excessive amount of thinning will become risky. It is able to increase your threat of inner bleeding, hemorrhagic stroke, or a weakened heartbeat without you even feeling a unmarried symptom. No complications, no chest ache, not anything. Something very incorrect occurs. I have had sufferers are available with unexpected bruising, dizziness, or maybe coronary heart palpitations. Handiest to find out that they're wholesome. Addiction of taking high-dose diet E was quietly tipping their coronary heart out of stability, and the technology backs this up. I have a look at posted with inside the Journal of the American Medical Association. JAMA confirmed that excessive doses of diet E over 400 IU every day have been absolutely associated with expanded threat of coronary heart failure in older adults. It is stunning, I realize. Specifically, while you notion you have been doing the proper issue, so what is the more secure alternative? Food primarily based totally diet. E is your fine buddy. A handful of almonds, a tablespoon of sunflower seeds, a facet of steamed spinach. Those ingredients provide diet E in herbal quantities, balanced with different vitamins your frame can use accurately in case you nonetheless experience the want for a complement. Speak in your physician, and never exceed 200 IU day except you've got a scientific circumstance that really calls for it earlier than you're taking that subsequent tablet. Pause and ask yourself, is that this really helping my coronary heart? Or simply something I've been instructed to accept as true with 4 years, due to the fact every so often. Maximum risky selections are those we make on autopilot. Now let's speak approximately calcium, the one complement nearly each senior has been instructed to take. You've heard it 1,000 instances. Take calcium to shield your bones, and it makes feel in spite of everything as we age, our bones lose density and the concern of fractures will become very actual. So naturally, like tens of thousands and thousands of different older adults, is probably taking a everyday calcium tablet hoping to live robust and independent. However, this is the component they forgot to tell you. Calcium does not realize in which to move in your frame, except you deliver it the proper guidelines without the assist of another key diet. K2, that calcium can grow to be with inside the worst viable region, your arteries. It's proper rather of strengthening your bones. It can be silently hardening your blood vessels. I've visible it time and again. In my exercise, seniors are available in with fantastic bone density assessments. However, they are additionally dealing with excessive blood, stress, chest, tightness, or maybe coronary heart assaults. And while we look deeper, their arteries are stiff, calcified like stone, and lots of them have been taking calcium dietary supplements every unmarried day. The technology in the back of this is clean. Calcium is vital. However, while it floats around without right steering, it can settle in smooth tissues, specifically the partitions of your arteries. This leads to arterial calcification, a circumstance where your blood vessels grow to be stiff slender, forcing your coronary heart to paintings harder simply to transport blood through the years. This will increase your danger of coronary heart failure, stroke, or even kidney troubles. Diet K2 acts like a site visitor's officer. It tells calcium, no, now no longer there, visit the bones, now no longer the arteries. Without it, calcium finally ends up inside the incorrect locations, but maximum, over-the-counter, calcium dietary supplements do not consist of K2. It really is now no longer only a small mistake, it really is a massive danger. So what should you do as a substitute? First, attempt to get calcium from meals, leafy vegetables like kale and collards, yogurt, cheese, sardines with bones. Those resets come naturally, balanced with different vitamins like magnesium, and now and again a touch K2. If you need to take a complement, select one that mixes calcium with each diet K2 and magnesium. Those three paintings as a group: calcium builds bones, magnesium helps absorption in K, to direct site visitors and of direction usually communicate to your medical doctor earlier than beginning or persevering with a calcium habitual. Because robust bones do not count number. If your arteries are turning to stone, let's move directly to one of the maximum misunderstood vitamins of all, iron. Like something absolutely each person wishes proper, it fights fatigue, helps energies, and allows your purple blood cells to deliver oxygen. So if you feel worn out, it is clean to assume perhaps I'm low on iron. It really is why so many seniors select out up an iron complement or take a multivitamin that consists of it simply to be secure. However, this is the truth that hardly ever receives shared maximum. Older adults do not want greater iron. In truth, for many, it could be dangerously poisonous. Unlike a few nutrients, your frame has no natural manner to remove extra iron. If you take extra than you want, it would not simply biscuit via your gadget. It remains, and it builds up on your liver, joints, mind, and your coronary heart. This gradual iron buildup creates something referred to as oxidative pressure. Think about it like rust forming internal your frame through the years. That rust starts to harm tissues, specifically the coronary heart muscle. It could weaken the strength of your heartbeat, disrupt the rhythm, slowly push your coronary heart in the direction of failure, and the worst component you would possibly by no means feel it occurring till it's miles. Alongside, I've met older adults who got here to me complaining of weird fatigue, mind fog, joint stiffness, matters they assumed to have been simply growing old. However, while we regarded cholecystothate iron overload resulting from years of needless supplementation, there's even a call for it. A situation wherein an excessive amount of iron slowly poisons your organs. A few humans have a genetic model, however many broaden it simply through taking iron without having it. So this is the golden rule. By no means take iron until your health practitioner has examined your stages and showed a deficiency, meaning checking for iron saturation, and general iron binding potential. Now, no longer simply assuming, primarily based totally on how you experience. In case your iron stages are fine, taking greater may not enhance your power. It will quietly damage the very organ that's running toughest to hold you alive. Get your iron from meals as a substitute. Spinach, lentils, eggs, and lean meats provide mild, balanced quantities. And in case you ever do want an iron complement, your health practitioner need to manual the dose and display it cautiously. Now let's speak approximately something that sounds so harmless it is almost by no means. Puzzled nutrition. B6. You will locate it anywhere in sleep aids, power boosters, reminiscence, tablets, and multivitamins advertise, particularly for seniors. It is regularly promoted as natural, secure, and vital for mind and nerve characteristic, and that is now no longer incorrect in small quantities. B6 is essential. However, this is wherein matters get elaborate. An excessive amount of B6 would not simply forestall assisting, it begins a feebled hurting over the years. I've had many older patients are available in with court cases, which might be smooth. That is what reasons the burning numbness and nerve weak spots such a lot of seniors conflict with. However, it would not forestall there. B6 and extra also can intervene with the electric indicators that hold your heart beating in rhythm that could lead to palpitations, skipped beats, or even risky arrhythmia, especially while mixed with different dietary supplements or medicines. In maximum, humans don't have any idea that is taking place due to the fact they assume greater is higher. The endorsed daily quantity of B6 for adults over 50 is simply 1.5 to 2 mg. However, a few dietary supplements include 10, 20, even 100 mg consistent with dose, And whilst you upload up more than one tablets, fortified ingredients or power liquids, the overall skyrockets without figuring out. So what does the secure man afford? Consciousness on meals primarily based, totally B6 from mild nourishing, reassets like bananas, chickpeas, tuna, and fortified cereals, and in case you're thinking about a complement, have your stages examined and by no means take high-dose B6 without a health practitioner's supervision. Keep in mind you're worried. Gadget and coronary heart. Grow to be greater touchy with age. What you may want to tolerate for your 30s or 40s may. Now, purpose signs you don't associate with the nutrition in any respect now. Permits talk approximately one of the maximum not. Unusualists, dietary supplements of all of the multivitamin. Stroll into any pharmacy or grocery store and you may see rows of packing containers labeled Coronary Heart Help Senior Power or 50+ necessities. They promise electricity, safety, readability, even durability. All in a handy little tablet, however, right? Here's what no person tells you. Lots of those so-called coronary heart fitness multivitamins are packed with elements that could quietly harm your frame, specifically your coronary heart. As a coronary heart medical doctor, I visible at greater times than I can be counted. Number seniors are available in, with unexplained dizziness, irregular heartbeats multiplied, blood strain or liver pressure. They may be consuming well, workout, taking their nutrients religiously, so what is incorrect? Whilst we dig deeper, we discover a not unusualist thread: multivitamins loaded with hidden stimulants, megadoses, and natural blends. Now no longer designed for getting older, our bodies permit me come up with some examples. Extra niacin, nutrition, B3 can purpose flushing sudden drops in blood strain, and liver stress specifically in excessive quantities. Inexperienced tea extract origin, typically delivered for electricity, can spike your coronary heart charge raise. Blood strain and cause arrhythmias. Nutrition A in massive quantities can grow to be poisonous over the years, inflicting dizziness, nausea, or maybe lengthy time period organ damage. And right here's the worst component: you often might not even understand what is in those tablets. Cover elements beneath vague labels like proprietary mixture or natural complicated. It sounds secure, however your frame, specifically your coronary heart, does not care what the label says. It handiest reacts to what is really inner as we age. Our hearts grow to be greater touchy. What may be innocent for your 30s can flip dangerous for your 70s. It really is why the guideline of thumb greater is higher now no longer applies. So what have to you do? Maintain it easy. Avoid multivitamins with lengthy aspect lists or electricity claims. Pick out merchandise with transparency, modest dosages, and no pointless herbs. Most significantly, bring your complement listing on your medical doctor and ask, do I actually need all of those? Due to the fact your coronary heart merits greater than a flashy label, it merits care, readability, and a touch much less clutter. Now that we have got exposed those 5 hidden risks, you'll be wondering, what have to I take? Rather, what vitamins are really secure and beneficial for seniors? Don't fear, we are attending to that. Permits wrap up with the nutrients that actually help your coronary heart as you age and the way to use them the proper manner. So right here are 3 dietary supplements that actually help the getting older. Coronary heart nutrition D3, specifically important for older adults who live interior or stay in chillier climates. It supports blood strain law, immune fitness, and facilitates guard each bones and coronary heart energy. Many seniors are low on D3 without understanding it. So A, easy blood. Take a look at can manual. Secure supplementation, magnesium, regularly omitted, however crucial for maintaining your coronary heart's rhythm steady, lowering muscle cramps, and improving sleep. It is particularly useful in case you've ever skilled coronary heart palpitations or tension. Magnesium additionally facilitates regulate calcium motion, helping each bone and vascular fitness. Omega-3 fatty acids, preferably from fish oil or flaxseed oil. Those healthful fat lessen inflammation and enhance blood vessel flexibility. They assist maintain your arteries clean in your coronary heart, pumping efficaciously. Heart assault and stroke, however, here's what subjects extra than the label on any bottle, no compliment, will ever update a healthful lifestyle, which means transferring your frame each day. Only a stroll across the block, consuming real complete meals, complete of shadiation and nutrients, napping, deeply handling pressure, and staying linked to folks that care approximately you much less is regularly extra, particularly on the subject of dietary supplements. The goal isn't always to deal with your frame like a lab, it is to help it like a lawn with interest, goal, and care. And finally, I need to depart you with this. It is never too past due, now no longer at 60, now no longer at 70, now no longer even at 90. Your coronary heart is exceedingly resilient, even after years of pressure or misguided alternatives. It nevertheless desires to heal, however you ought to supply it. The threats of these days? I invite you to take that first step assessment, your complement listing, ask questions, communicate for your physician, choose with goal. Your coronary heart has been with you each unmarried day of your lifestyles. Now it is your flip to expose up for it with know-how, care, and braveness. In case you found this video useful, depart a remark with one underneath, and consider to love, share, and join health. 365 for extra sensible fitness hints. Designed simply for you due to the fact you continue to have a lot of lifestyles to stay. Let's make it a robust, clean, and heart-healthy one together.